The Advisory Committee on Immunization Practices schedules their next meeting. The Secretary of Health and Human Services prepares to testify on Capitol Hill. And, less than a month into the job, the CDC director is fired by the president. For the week of September 2nd, 2025, from Capitol Hill in Washington, D.C., this is Health on the Hill, brought to you by Heart Health Strategies. I'm Matt Duckworth.
I mean, from my vantage point as a doctor who's taken the Hippocratic Oath, I only see harm coming. I may be wrong, but based on what I'm seeing, based on what I've heard with the new members of the Advisory Committee for Immunization Practices, or ACIP, they're really moving in an ideologic direction where they want to see the undoing of vaccination. They do want to see the undoing of...
Kicking off this week's episode with news from the administration, where Susan Maneras was fired as the director of the Centers for Disease Control and Prevention on Wednesday, less than 1 month into her tenure as the first Senate-confirmed leader of the U.S. National Public Health Agency. On Wednesday night, a White House spokesman said, quote, Susan Maneras is not aligned with the president's agenda of making America healthy again, unquote. According to reports, Maneras refused to fire top CDC officials and endorse vaccine policy changes pushed by U.S. Department of Health and Human Services Secretary Robert F. Kennedy Jr. When asked to resign by the White House, Maneras refused. She's now challenging her dismissal, arguing that the termination was not valid because it did not come directly from the president. Several top leaders at the agency resigned immediately following the news of Maneras' ousting, including Dr. Deborah Horry, CDC Chief Medical Officer, Dr. Dimitri Desilakis, who you just heard, Director of the National Center for Immunization and Respiratory Diseases, Dr. Dan Jernigan, Director of the National Center for Emerging and Zoonotic Infectious Diseases, and Dr. Jennifer Layden, Director of the Office of Public Health Data, Surveillance, and Technology. Senate Health, Education, Labor, and Pensions, or HELP Committee Chair Bill Cassidy, a Republican physician from Louisiana, stated in a post on X that, quote, these high-profile departures will require oversight by the HELP Committee, unquote. HHS Deputy Secretary Jim O'Neill has been named the acting director of the CDC. O'Neill served at HHS during the George W. Bush administration and is the former CEO of the Thiel Foundation. On Wednesday, the Food and Drug Administration revoked the remaining emergency use authorizations, or EUAs, for COVID-19 vaccines. While individuals between the ages of 6 months and 65 years at higher risk of severe disease from COVID-19 will still be able to obtain immunization, the shots will no longer be easily accessible for all Americans. Younger people with a pre-existing condition who wish to be vaccinated against COVID-19 will need to first consult with their doctors to determine whether the vaccine's off-label use is medically appropriate. For those at higher risk of severe disease, the FDA has issued marketing authorization for Moderna's vaccine for those 6 months and older, Pfizer's vaccine for those 5 years and older, and Novavax's vaccine for those 12 years and older.
In terms of the changes to ACIP, this has been a long time coming. So the people who were in charge of that are now gone. And we're going to bring people onto the ACIP panel, not anti-vaxxers. We're bringing people.
The Advisory Committee on Immunization Practices, or ACIP, has scheduled its next meeting for September 18th and 19th. The agenda includes discussions of COVID-19 vaccines, the hepatitis B vaccine, the measles, mumps, rubella, varicella, or MMRV vaccine, and respiratory syncytial virus, or RSV. Senate Health Committee Chairman Bill Cassidy has called for the meeting to be indefinitely postponed following the recent shakeup to CDC leadership and changes to the nation's vaccine policies. CDC Director Susan Maneras was fired on Wednesday, the same day the FDA acted to limit approval of COVID shots to a smaller population of people. Chairman Cassidy said in a statement, quote, "Serious allegations have been made about the meeting agenda, membership, and lack of scientific process being followed for the now-announced September ACIP meeting." He went on to say, "These decisions directly impact children's health, and the meeting should not occur until significant oversight has been conducted. If the meeting proceeds, any recommendations should be rejected as lacking legitimacy, given the seriousness of the allegations and the current turmoil in the CDC leadership." Unquote. Final news today, where HHS Secretary Robert F. Kennedy Jr. will testify before the Senate Finance Committee on Thursday. The HHS Secretary's appearance before the panel, which was planned before last week's changes to CDC leadership, will focus on the President's 2026 healthcare agenda. It will be lawmakers' first opportunity to question Kennedy face-to-face since May, when he testified before the appropriators about the department's fiscal year 2026 budget request. Senator Bill Cassidy, a Republican physician from Louisiana, who has expressed concerns about the recent moves at HHS, is a member of the Finance Committee.
Good morning and welcome everyone to the organizational meeting for the 119th Congress.
And I welcome everyone to the first Health Committee meeting of the 119th Congress.
Good morning and welcome everyone to the first meeting of the House Committee on Energy and Commerce of the 119th Congress.
The Finance Committee will continue its long tradition of addressing these matters in a manner that invites bipartisanship.
We end each week's episode with a call to order, where we lightning round congressional meetings and hearings in the near future that you need to know about. First, on Tuesday, September 2nd at 5 p.m., the House Appropriations Subcommittee on Labor, Health and Human Services, Education, and Related Agencies holds a markup of their fiscal year 2026 legislation. Second, on Wednesday, September 3rd at 10:15 a.m., the House Energy and Commerce Health Subcommittee hosts a hearing titled "Examining Opportunities to Advance American Healthcare Through the Use of Artificial Intelligence Technologies." Third, on Thursday, September 4th at 9:30 a.m., the Senate Finance Committee convenes an open executive session to consider the nominations of Gustav Cirillo to be Assistant Secretary of Health and Human Services and the Honorable Michael Stewart to be General Counsel of the Department of Health and Human Services. And last, on Thursday, September 4th at 10 a.m., the Senate Finance Committee gavels in a hearing entitled "The President's 2026 Healthcare Agenda," featuring Secretary of Health and Human Services, Robert F. Kennedy Jr. Thanks again for tuning into this week's episode of Health on the Hill, brought to you by Heart Health Strategies. For more information on this week's healthcare happenings in the administration and on Capitol Hill, you can visit our website at hhs.com and click on the news section at the top of the page. You can subscribe anywhere you get your podcasts, including Apple Podcasts, Spotify, YouTube, and SoundCloud. Did we miss a story you wanted to hear this week? If so, email me at mduckworth@hhs.com, and we may include it in our next episode. Have a great week, and stay healthy.